I'm going to update you a little bit on what we're doing with TRACK-TBI. I spoke to this group about 2 years ago when we were launching this study, which is turning out to be one of the largest studies that's ever been done, actually in clinical neuroscience, not to mention traumatic brain injury. And also just to mention a companion study, which is funded by the DoD called TED, which is this TBI Endpoints Development Initiative, which is really meant to take some of the science that we're doing and to turn this into really usable biomarkers, as we just heard about, or ways to get patients enrolled in clinical studies and to look at the endpoints that we can use to measure differences in outcomes so that we can get new diagnostic tools and new treatments. So just in the last year, we've continued to expand. We're up to 18 sites. These represent really the top trauma centers in the country. And we are now at 2,400 subjects. With these 2,400 subjects, because this is a precision medicine study, we're not just collecting medical information, but we're getting images, we're getting CT scans, we're collecting bloods, and we have a tremendous amount of information. So just for example, in the MRI scans, we have a large series of MRIs, and we just heard Josh talk about how we could use an MRI as a biomarker to phenotype. So without going into a whole lot of detail, we've got new structural approaches to this. We've got different kinds of ways that we can look at brain function, we can look at connectivity. And what this has done is provided us with new insights into the brain, but to really move beyond just simply doing a science project, if you will, into something that can actually be used throughout the country, we've paid a lot of attention to standardization. So the way that we're doing this can be run on a GE magnet, it can be run on a Siemens magnet, it can be run on a Philips magnet, such that the sort of work that we're doing here and the discoveries that we're making can be run in every hospital in the country, whether you're going over here to the Queen of the Valley or wherever. Whoever has a 3T MRI scan will be able to run these so that we can actually disseminate and replicate what we're learning here to help individual patients. Not just discovery, but also how do we implement. Really, when we talk about implementation and how are we going to take these biomarkers and move these into a space that are going to be useful. So I think that while on one hand with precision medicine, we're really describing the natural history of the disease at a level that we've never been able to by looking at the genetics, looking at the proteome, if you will, and looking at all these aspects. We really, for us to sort of, somebody just mentioned the NFL, for us to get over the goal line, so to speak, we've got to have things that can be used in clinical trials. So the goal of our group is actually to change the way that we're doing clinical trials because like many of the other folks that are in the room here, the brain has been a tough nut to crack. And we've had failure after failure. We have 33, 34 failed clinical trials in traumatic brain injury. So I'm very pleased that just this April of 2017, for those of you who know about traumatic brain injury, we use a coma score that was developed 40 years ago, before we even had CT scans. And then we grossly divide these people into mild, moderate, and severe. Can you imagine if we tried to cure cancer today with mild, moderate, severe? Yet we take the most complicated injury and the most complicated organ in your body, and this is what we do with it. So it's just the same thing that Josh is talking about. We've got to be able to start to put these into smaller groups. Well, one of the ways that you can do this is with biomarkers. And so what this represents is a letter of support from the Food and Drug Administration that says, yes, we need to move beyond the coma score in order to stratify and enroll patients into these clinical studies. And so this recognition is going to help to move the field along further, to move past the GCS and to start to look not only at the imaging biomarkers, but I believe, as General Corelli will tell you later, we've been doing quite a bit of work with some name brand companies on this topic of blood-based biomarkers, and we're very, very close to really moving this forward. And we currently have a request for a letter of support for these blood-based biomarkers so that we move past these symptoms and get on to some objective things that we can use for these clinical studies. So in effort to introduce the next speaker here, Dr. Sam McLean, we had started this effort being funded by the National Institutes of Neurological Disorders and Stroke, and then Josh is the head of this group over here, the National Institute of Mental Health. And those of us who work in brain injury understand that brain injury is not just your cognitive performance, that when you injure the brain, that these patients, 50% of them develop depression. Up to 30% of them can develop post-traumatic stress. There's anxiety that comes along with this. And so when you injure this brain, it's not just this left side, which is funded by NINDS. It's also this right side that's funded by NIMH. And historically, these things have been siloed. And we can talk about this later at dinner or whatever, but there's been a division. And from my very simple perspective, whether we're talking about cognition or we're talking about brain health, it all comes out of right here, right? So this idea of keeping these things apart is not going to move us where we need to go. We've got to come back together again. And so I was very fortunate when Sam called me up after being funded for this grant and said that I understand that you've been working with a philanthropic organization, One Mind, and that you put this big group together, and you've got all these people that used to compete with one another, now all working together. What can you tell me? And so from this, I talked to General Corelli, and he then was able to find some funds. So the study that you're going to hear about next is Aurora, which is a study of really what is the brain health aspects of when there's a trauma that takes place. And so obviously my disease is traumatic brain injury, and he's looking at mental health or brain health after trauma. You can see that there's really a natural association, but not really at the sort of the governmental structural level. So with the help of One Mind, in July of last year, and I think the goodwill of all the investigators involved in TRACK-TBI and Aurora, General Corelli was able to provide funds with your all's help for us to get together in Seattle and to really start to talk about, because we understand that this stuff is very intertwined, if we really want to learn how this works, we've got to figure out how to work together. So we started on an effort of harmonizing many of our brain imaging sequences so that when he's looking at someone that just came in the emergency department with a physical assault, and I'm looking at somebody that had a traumatic brain injury, that we can compare these images. Our blood-based biomarker protocols in terms of being able to get these biospecimens are exactly the same, so that what he's calling a post-traumatic event, what I'm calling a post-traumatic event, if we're going to look for a blood-based biomarker, we can look at them exactly the same. And the outcome measures that we use, while it's difficult to be 100% overlap, because there are things that are trauma brain specific versus post-traumatic brain health specific, there is a real effort on our part to try to line these things up to where we can come together. And so what I would refer to this is really trying to bring this back together, and really mega team science is moving beyond just, we've learned how to build teams and to take competitors and turn them into collaborators, but now we're trying to reach across institutes at the NIH to really, we all know that this all comes out of right here, and we need to figure out how to bring this back together so we can all learn from one another, because there's going to be threads through all this that are going to lead us to discoveries. Much of what we've learned about how the brain works is when we injure it. And so I was just looking at Connor's data here of these 1,000 patients. We're going to have 1,000 brain injured patients. Imagine if we start looking at areas of the brain that we know that have been injured. How do those work, and how does that relate to mental health? I think we're really at the threshold of some amazing times here. And it's because of organizations like One Mind that really help us to fill in these gaps and bring us together in a way that the government, frankly, is just not structured to do, or companies are not structured to do. But I think what we're seeing is that we now know that these problems are too difficult for me to decide on myself or Sam or anyone else, and that we all have to work together to solve this. So with that, I'm going to introduce Dr. Sam McLean. He's an emergency medicine physician at University of North Carolina, and he's going to tell us more about the Aurora story. Sam?
Thank you, buddy.